Hello, Udi.
Hello, how are you?
Great. Here we go. It's so great to see you today. We first met in 2016 when I started a 3-year global health fellowship at the CDC, and you were part of the Epidemic Intelligence Service program, the EIS program.
Yes, that is correct.
You began your career as a clinician, but quickly found yourself working at the intersection of outbreak control, immunization, and health systems. From treating children at their bedside to shaping epidemic responses in Liberia during the Ebola crisis, your path highlights how strong systems can make the difference between lives saved and lives lost. You've worked alongside governments, global partners like WHO, and local health workers to strengthen infection prevention, restore immunization, and improve equity in access. Today, I'd love to explore what you've learned about building resilient systems, especially in the face of crisis, and what lessons you'd want to pass on to others who are interested in making an impact in public health. So, our first question for you today. As someone who started as a pediatrician and later worked in outbreak control and epidemiology, what first showed you the importance of strong health systems beyond the clinic?
It's a great question. When I first started, like as a med student in the clinics, uh, it was just after the 14-year civil war in Liberia had ended. So vaccination rates in general was just really low, to the point of we used to have a measles season, and we'd had half the ward that was dedicated to measles during that period, because so many kids had been born and not vaccinated and were at risk. And that is like an example of sort of like how a health system sometimes collapses when um, there's just something happening, right? So by the time the war ended, we had like about 100 doctors for 3.5 million people, showing how much the health system was stretched. And on a good day, you could maybe have like 3 deaths in the pediatric ward. On a bad day, it could be as high as 10 as a result of just basic preventive uh, methods not being available to people. Um, by the time the Ebola epidemic started in 2014, 2015, um, much progress had been made. So we'd gone from like a 60 odd percent coverage of measles vaccination to like 80. And it was interesting because that progress then determined the fact how we kind of sort of almost missed a, the first pediatric Ebola case, because the intern on call had not really seen, we'd stopped seeing these measles cases as a result of vaccination rates going up, right? And he was not familiar. So this child presents with like a rash, and in his mind, reading the symptoms, it looked very much like a measles rash. So the one good thing he did was, isolate the patient and put them in isolation and quarantine while senior staff could come and assess the patient. And that was when we sort of realized, like, oh, sometimes Ebola also presents with a rash.
Oh.
But I think that is a good example of sort of like how um, systems can fail and then get strengthened and work, right? But that whole experience of working in the clinic and seeing all those deaths really pushed me towards how can I make a bigger impact? How can I move away from individual saving of a life to a larger impact at a population level, and what drew me into public health.
I actually had a very similar trajectory myself. I was working in like an NGO that did work on domestic violence and sexual violence, and what I was seeing every day, I just kept thinking I'd like to prevent this from happening in the first place, and that's why I wanted to go to CDC too, where I met you. So nothing
Yeah.
like Ebola, but I recognize the thought process.
Yeah.
My next question, thank you for all that experience, sharing that. My next question is, how did infection prevention and control, IPC efforts during Ebola change the way hospitals and clinics functioned?
Yeah. So, immediately after the war and, prior to the Ebola outbreak, the government and the health system was very focused on providing basic essential services. And as a result, there were certain infrastructural gaps that were overlooked, one of them being infection prevention control. So there wasn't much uh, training available during that time period prior to the Ebola outbreak. Many hospitals and health facilities did not have running water. There wasn't always water available for basic hand hygiene. That was a big challenge. And then fast forward into the epidemic and understanding the importance of infection prevention control, of not reusing gloves, of making sure there's proper hand hygiene practice, that there's access to free running water within health facilities, was like one of the big changes that came about, um, especially at the facility level. So training for healthcare workers around IPC, improved sanitation and water access to practice good hand hygiene. At a larger, more national health system level, some of the big things that came out of the Ebola epidemic was, the first infection prevention control strategy for Liberia, the first infection prevention control policy and guidelines for healthcare workers. These were like real key documents that helped to um, establish standards across health facilities throughout the country and have everyone on the same page, which was something that hadn't been there before. Um, and also like the integration of infection prevention control training into pre-service, which makes sure that you have a healthcare workforce that comes out with that knowledge.
I didn't expect to see so many cross-sector ties, but I've been working on postpartum hemorrhage this year, and a lot of learning a lot and writing a lot about training midwives to address it when they're still in their initial training. So it doesn't have to come later when it can be part of the foundation. So I'm hearing a lot in what you're saying about sort of foundational global health concepts of preparing in advance and being ready before something falls apart.
Yeah, definitely. And I think even now, like more than ever, I think, when we talk about sustainability within the context of global health, right? It's always easy to design a one-time training. But the idea that it's a one-time
Yes.
training means that once those individuals leave, and again, we need to remember that healthcare workers are not static. They're always moving in and out of the health system, searching for better opportunities, right? And the best way to make sure that a knowledge or capacity is built and is always available in a country is to make sure that certain skills are incorporated into pre-service learning in nursing schools, midwifery schools, medical schools, that
Mhm.
as people come out, they already have that knowledge. So then you don't have to keep training a
Mhm.
new group of healthcare workers at a facility every time.
Mhm. Or put them in the situation where they're just part of pilots.
Exactly.
Yeah, that aren't sustainably implemented or monitored for renewed information, updated information. Yeah.
Exactly.
Well, the next question I have for you moving forward, there's so much here, is about donors and partnerships. You worked with both international partners and local institutions. What's your perspective on partnerships like Gavi? What they do well, where they struggle?
Yeah. I think partnerships both at the local and international level are very important, especially in low resource settings where sometimes there isn't the funding to really fund major interventions such as immunization, right? Um, where sometimes the cost of a single vaccine can be very expensive and beyond the reach of a country, even if they want to implement it. So having these big partnerships that allow for better negotiation for vaccines with the pharmaceutical companies, entity like Gavi can really help with that. Um, on a slightly lower level, when you look at how partnerships work also with at the national level, um, example from Ebola, right, where you had a rapidly spreading epidemic, understanding local context is important. Being able to actually partner and see both entities sort of being at an equal footing instead of one coming in and dictating, right? And this was something we saw early on in the epidemic when Liberia, being a Christian majority country, does not have a culture or historical practice of cremation. And when there was an increasing number of cases, some of the initial guidance that came from the international space was, for good infection prevention control practices, just, completely cremate the body. That way, you're kind of, because for cases of Ebola, like a dead body becomes like a very infectious source, and anyone coming in contact with it, is more likely to spread. So, the guidance was like just collect all the bodies and have them burned. However, in a culture that's not where that is not acceptable or
Mm.
considered very foreign, what that meant was communities immediately stopped reporting
Oh.
cases and death,
Mm.
right? And this led to people secretly, one, not notifying health authorities, two, secretly burying family members in the backyard,
Mm.
in spaces, and increasing the spread because now they are handling a contaminated, infectious
Mm.
body. And that sort of like led in many ways to the epidemic spiking initially till people understood, like, wait
Mm.
a minute, this guidance doesn't work in this setting. Like, we need to allow people to bury the bodies. And so as a result, the government and partners had to come together, decide on a special burial ground that was
Mm.
going to be designated for the death of those who had died from Ebola.
Oh, wow.
The government had to identify the land. They had to sort of pass that message into the communities. The international community had to help support burial teams that would like go out with full hazmat suits, be able
Wow.
to collect the dead body, decontaminate the room, the space that the person had been in, um, link them to contact tracing, and then bury the body, and in that way allow for the survivors to have a place to go and grieve, but
Mm.
also to kind of maintain and that cultural respect, right? And
Mm.
for partnerships, that is important, is
Mm.
having respect and understanding that both sides have something to bring to the table, and not going in as, oh, I'm an expert and I know what's best for this setting.
Such a good lesson for the global health field. And can I also ask you, do you think that that change in policy made us was one of the significant factors that helped
Yes.
end that epidemic? Yeah.
Yeah,
Wow,
it
that's
was
really
definitely a
interesting.
turning point in the number of cases and the spread. Once the public could now trust the health system and the
Mm,
government, that, you know, their family members was not just going to go into ash and there was going to be nothing for them to kind of use as a memorial or anything like that, that there was this physical place that they could go that according to their tradition and rights they
mm,
could dispose with respect the
mm.
dead, and be able to go back again and grieve. That made a big difference. People were less likely to like do a hidden burial. They were less
Mm.
likely to avoid the health system as a result of that.
Wow. These lessons on respect are important across any sector, but especially important in global health and international partnership.
Yeah, definitely.
Next question for you. Thank you. Looking back, this is about systems and resilience. Looking back, what changes in Liberia's health system after Ebola made you hopeful about resilience? And what vulnerabilities still concern you?
Yeah, so I mean, I think there's so many different pieces that teaches to the resilience of the health system, right? We went from a point where multiple health facilities were shut down because of um, contamination, because of healthcare workers falling ill, and the need for staff to be trained, for facilities to have better infection control processes. Um, and, you know, with training, with investments, all of this was addressed. Like I mentioned earlier, some of the outcomes of that was clear policy, guidelines, strategy, right? So there's a whole toolkit of infection prevention control documents that the health system can use now. It's the same for preparedness and response, epidemic preparedness and response. There's very little infrastructure built around that prior to the epidemic. But out of the Ebola, that's one of the things that came out. Liberia started a field epidemiology training program, FETP program. They established the National Public Health Institute. So all these like major infrastructural changes that have come out of the Ebola epidemic, which definitely now contributes to a bit more resilient health system. Now the country does have the capacity that when an outbreak happens, they can respond to it in the
Mm,
right way. And since then, there've been Lassa fever outbreaks. There's been monkeypox. There's been COVID, and all these infrastructure has been scaled up and an appropriate response generated during all of that. The concern and issue is where will investments continue, right? And how changing economy, changing government priorities can shift what investments are being put where. Oftentimes, with health systems, it's a big challenge to justify to governments the need for
mhm.
continued investment into that sector.
Prevention.
Yeah, prevention, right? It's always harder to make the case for prevention. It's because it's sort of this downstream effect for governments. And as a result, these big public health interventions, capacity building can sometimes be hard to sell for governments and to maintain um, the prioritization and investments.
Hmm. Actually, I wanted to ask you next about systems financing. We've talked quite a bit about Ebola and your experience in Liberia, but you've worked in so many countries. So from your more global perspective, how does financing, whether donor or domestic, shape whether systems can sustain immunization and outbreak response?
Yeah, I think, it ties back to some of what we talked about earlier, right? It's partnerships, right? I think funding works best when there's a good partnership, there's a good understanding from both partners how the funds are going to be used, how it's going to be prioritized, right? I think sometimes some of the challenge with donor funding is where donors have their own priorities that don't often align with government priorities. And as a result, you can have a program that starts but will not be sustained because once the funding dries out from the donor, the government is not willing to redirect funding to that. I think the other thing about financing and is, you know, from the very initial stage, you want to make sure that this thing you're doing has a exit plan as a donor or as a government, that you know what is going to happen. Is this just a project that's going to be for 3 years and that is the goal? It's fine if that is if it's a demonstrative project, if it's just the idea is to show proof of concept, that makes sense. But if you're actually trying to make a system change and trying to make a sustainable difference, you have to think about what that sustainability is going to look like at the planning stage. At the stage when the partners come together, the donor government, the donor agencies, and the local government sits down, there needs to be a plan. And oftentimes with financing, that doesn't happen. A donor comes in with a couple of $1 million. They want to do a project. It doesn't necessarily align with the government, but the government recognizes that there will be a benefit for the public. They say yes, and then the funds run out, and then there's a struggle with how the government can sustain that. And sometimes it can be tricky. I know in Liberia, post war, when there was so few health facilities that were functional, that was running, MSF was running a hospital. And MSF usually comes in during an
Let me
emergency.
just say, in case anyone listening doesn't know, that's Medicine Sans Frontiers, Doctors Without Borders.
Yes, thank you for that. And what happened is, like, they come in usually during the peak of a crisis and provide services. And because the health system was never, when they came in, it was so bad, and it took so long for the government to actually be able to pick up and take over from MSF. It was what MSF wanted to, like, come out of that facility and hand it off to the government, but it took like 5 years for them to actually do that, just because of how much it was negotiations needed to happen, and they couldn't just, like, lay off people and withdraw when the government wasn't ready to take over. So there needs to be that consideration at the early stage. How is this going to play out? And where is the funding going to come? Can the government absorb this particular program? Does it align with the government priorities? A country like Liberia, where 40% of the population is below the age of 14, where the major causes of diseases is, infectious diseases, malaria, diarrhea, respiratory diseases. Bringing in a chronic disease program, while important, is not necessarily the major mortality that the government is struggling with. The government is trying to reduce neonatal mortality, under 5 mortality, maternal mortality.
Right.
So sustaining a non-communicable disease program sort of becomes a deprioritized thing for the government.
Mm. That reminds me of a lot of things I've seen in my own various global health experiences. One of them being that there has been funding available for projects that have an HIV component in different places that I've been. And then sometimes organizations apply for that funding, and then they HIV lesson to a children's school project where they improve like the playgrounds and the facilities. And I know that I've read a lot about how they found that that is unfortunately not effective. Just teaching anyone about HIV, of course, all public health education is better than not having it, but it doesn't actually focus on the target populations that are most at risk. And so that money is, in a way, wasted where in terms of it could have been used better elsewhere, basically. So,
Yeah, I agree. I think across the world you can find, thousands of projects like that where, donor funding did not match government priorities and wasn't really thought out well. And you have these projects that, work for a couple of years or whatever, and then you don't get sustainability. It's not effective. And it's largely because of that lack of a good partnership and discussion from the early stage.
yes, and that can be more or less extreme. It could be, okay, this money went to funding a children's preschool renovation rather than educating people who are more at risk of this health issue. That's kind of like a
Yeah,
lower level, but it could also be getting people signed on to a program that provides them life-saving medication, and then all of a sudden that medication isn't available anymore, and they rely on it to live. So this
exactly.
covers this is very important to think about across all health issues and across all countries, the way that people rely on donor systems. Yes, thank you. And my last question for you today, Udi, is about advice to people interested in global health and students. If students want to work, for example, on immunization or health system strengthening, what do you wish they knew before entering this field, besides everything else you've already said?
Um, and I think this kind of touches back to some of what we've talked about earlier. But one thing I always tell young career people is that follow your passion, right? Because as long as you love what you're doing, it's no longer work. It's just you doing what you love, right? So if, global health is your passion, then, identify what it is about global health that you love and focus on that and keep that always in the back of your mind. Um, I would say, like, for me personally, what happened was my first passion and always has been children, youth. So, seeing young children die and thinking about, okay, how can I prevent that? How can we give young people a future? And, that's what brought me into public health. And now looking at some of the current work that I do, where again, it's like HIV prevention or violence prevention. Again, like, what is the child's perspective in this? Usually my job, whatever the project is to sit at the table and be like, okay, how do young people benefit from this? How can we make sure that, because again, we sometimes think that humans are a one size fits all, but an adult's needs and the way they interact with the health system is very different from how a child does that, how a young adult does that, and kind of keeping that in mind. So despite the fact that I'm not doing clinical medicine with children, I still bring that
Mm,
to my work because that's my passion, right? The other thing I would say is global health is a small world, right? Like, we met several years ago, in a different capacity, both of us in different training programs, and now we're in a different place in different roles in our lives, right? And I think remembering that and keeping in mind that relationships and partnerships, whether it's government, whether it's donor, whether it's individuals, matter. The people you meet, it's always good to leave a good impression, to respect them, because global health is a very small world. I cannot tell you how many times I've bumped into someone in a random country, in a random facility, and within minutes realize that we either met before somewhere, or like we're just 2 degrees away from someone we both know very well.
Mhm. Mhm.
And it also plays into connecting and job opportunities and making projects successful, because you then know the right people and you have this network of people that you can work with and who want to work with you. And then the last point I would say is whether you want to go deep or wide. So that is, do you want to be a subject matter expert on a particular disease, HIV, tuberculosis, malaria? That's one way to approach a career. The other way is wide. So for me, I've kind of gone wide. I have a little bit of experience with clinical medicine in pediatrics, with infection prevention control, with HIV prevention, with chronic diseases. So you can either decide to collect a wide range of skills that you can apply in different settings, or you can decide to focus on one disease.
So much good advice. I wasn't expecting all of that. That was great. Wow. Well, Udi, thank you so much for your time. Thank you for answering all these questions. I'm sure a lot of people will benefit from it. And one of the main takeaways I got from everything you said was about maintaining strong relationships and respect for
Yeah.
others. And I really appreciate you highlighting, or I really appreciate that, and I'm highlighting it.
Thank you
Yeah,
so much. This was a pleasure.
thank you.